Doctors, we are vulnerable ourselves. We're not prone to, immune to diseases and things. I have colleagues where they need to regularly see their GPs or specialists, and it just takes our time and away from community when we have to travel for, where we are, it's 7-9 hours from the city. So that's not viable. So this basically provides us the ability to stay here and service the community and basically, to be healthy ourselves.
With looking after myself, having the GP come out is a huge difference. So previously my GP was in Roma, so that's a 6-hour round trip. Doesn't work weekends, so that'd be a day off work essentially. And other services would be, Toowoomba or Brisbane, which is at least a couple of days.
We really need to attract and retain more health services, professionals, doctors, nurses to rural towns. In the long term, if all the patients have to travel far to get medical treatment, it will end up costing a lot more for the system. So it's just so much makes sense if we develop the towns, attract more doctors here and look after doctors in these rural towns, that the cost will decrease that cost dramatically, in my opinion.
It's just really important to sustainability, to be looking after ourselves and our staff. So at the end of the day, if I'm not looking after myself, I'm going to get burnt out. We're getting better, but we're not there yet as health professionals, and we need to, remember to put ourselves first, like the plane that's going down to get your own oxygen before others.
It works very well for me, and that I am more reassured myself that I'm being taken care of as well, and I'm on top of things in terms of my own healthcare. So if I can look after myself, I can look after my family and my patients.
We chatted with one of the doctors out there, and she goes to Toowoomba to see her GP. So that's one day every month or two that no one can see her. And she's already got a waiting list of at least 3 weeks. But if she can see someone in town and it takes an hour and she can have her normal life and see patients, that's an enormous benefit to that community who obviously really values her care.
That program helps support these healthcare professionals, whether you're a doctor, a nurse, an allied health professional, to access care also close to home, but not by a friend or a work colleague, by someone with a little bit of independence and that you can have trust in that person, people with lots of experience in the rural context as well. And supporting that workforce is a really valuable support service that the Foundation has offered.
It's made a huge difference to a couple of staff that I already know about in the short time that we've had the service, and it's possibly been life-saving in one of those cases.